Hello, I'm Dudley Thompson, and welcome to the WDT Media TV. We're now about to go live to the press conference called by the Minister of Health, give an update on the coronavirus. So we're going live now to the press conference. Just get on the way for updates on the coronavirus by the Minister Dr. Christopher Tufton. Here we go. In a controlled situation to prevent any spread, either to other members of the public or to healthcare professionals. I want to just reinforce the value, as Minister has said, of the quarantine process. It's very important that we pick up these symptoms early so that we can isolate these patients. And it is very, very important that we have quarantine facilities so that we are able to, in keeping with the restrictions, traveling restrictions that we have placed, that all persons that are coming back.
Anybody? Residents are concerned because they say some businesses will have to be relocated. That's true, right?
Where is that in relation to what it St. Joseph's?
Yeah.
Right. Relocated, you mean from the compound of St. Joseph's or in the vicinity?
In the vicinity.
I don't think so, but let me ask the CMO, Chief Medical Officer, to comment on the St. Joseph's location and the perceived risk, because I think that's important to address clinically.
The St. Joseph's Hospital compound is a large compound. One specific area that we would want to use for quarantine. Not all businesses on the property are going to be affected. And so therefore, many persons are concerned about the medical center and the doctors that are operating there. They're also concerned about the casualty department. The medical center will not be closed. This is some distance away from where we are going to be quarantined or where we intend to quarantine persons. So we don't believe that there is any risk that is posed to these persons at the medical center. The casualty department is actually on the same building adjoining the area, and therefore we are relocating the casualty department to the medical center. This will be able to facilitate persons who need to have emergencies, who need to come and see the doctor from 7 a.m. to 7 p.m. I believe that they are open. No, because the facility is at the medical center, we do not see a risk for persons being at the medical center. The virus is transmitted by droplets.
All right.
Area that we intend to quarantine persons. The other area is where we have a cancer treatment center for radiotherapy. So persons will access that through the separate roadway to that center. Again, we do not perceive a risk from those areas. For this patient has an elevated temperature, okay? It is not at the to cause this person, the temperature may continue to rise. What is important is that we have a rising temperature in a person who has traveled to an area of concern. The particular person has come from an area of China where there has been an increase in the number of cases. I think it is about the third highest province in terms of the number of cases. And so therefore we're not taking any chances. We're not taking any chances. So what we have to do is to monitor the case. As I said, this is a progression of symptoms, and we can't say what is gonna happen thereafter. However, we are testing. The sample has been taken, and it is going to be sent for testing. And then within another 2 or 3 days, we will get back that result, and we can either clear the patient or we continue isolation.
Oh, right.
Are you in a position to say how many persons are in quarantine versus isolation?
Okay, so Minister had mentioned it before. We have 10 persons that are being quarantined in a government facility, and we have 78 persons that are quarantined at home. I want to reassure everyone that the process of quarantine persons at home is not a simple one that we just send persons home. The homes are investigated by the health department. We ensure that there is adequate space for the person to remain far away from other persons. And we ensure that the patient, the person, is educated as to how it is that they conduct themselves, how it is that they move around. We ensure that the family is also educated. And then the health department checks on this patient on a daily basis. Now that check may mean that the person may have be given a thermometer and they're asked to check their temperatures and they're given a log that they monitor their symptoms. And this is reviewed by the health department on a daily basis. If necessary, the health department visits the home on a daily basis as well. Now, these persons, we have had cases where we have investigated home situations and we have found them not to be ideal for home quarantine. And those persons have remained in quarantine in a government facility. So this is something that we're taking very seriously and we're monitoring very, very carefully.
Understood. You didn't say how many are in isolation.
At present, we would now, with this one person that we're moving into isolation, we would have 2 persons in isolation.
Can you say the position of the previous person that was in isolation?
The previous person, okay, in terms of moving a patient to isolation, if they have come from an area of concern and they had any symptoms at when they landed, we would have moved them into isolation. That is our protocol. And the symptoms, when we had put any symptoms, is out of an abundance of precaution. Okay. So this person was moved into isolation, but when this patient was assessed, it was determined that this person did not meet the case definition. Okay. However, because we had put the patient in isolation, the person themselves had some concerns, we have continued to monitor the patient in isolation, and the person will be discharged at the end of their 14 days of observation. That person, however, their symptoms have resolved and they are much better now.
Can we get your question? Yes, what's what?
I have a couple of questions. The first one is the person showing how symptoms are asking whether it's male or female. And the minister mentioned that his family is having symptoms. Like estimation as to how long it could take for the novel virus.
Okay. Well, first of all, I just want to say that in Jamaica, we are developing our own capacity to test. Okay. As of the 12th of February, which is Wednesday, a PAHO team will be coming into country to train our laboratory staff to do testing. By the following week, we expect that we will have the capacity to test. Now, this is very fortunate for us because it's not every country is going to have that capacity. But because we have a national influenza center that is located at the University of the West Indies, we are fortunate to be able to be given this opportunity to be able to do our own testing. So in the interim, we have testing that has been done at CDC and at CARFA has now had their own training this week. CARFA is the Caribbean Public Health Agency. They are now able to test. So we can send this sample immediately to CARFA.
And how long will it take?
Okay, the time, the spin around time is 48 hours. Now, it's there are some cases that we will get back the result in 24 hours, and that is when all the initial screening are negative, and they can give us a negative result. But if based on the initial screening, there is something that indicates that there may be a positive sample, there is a further 24 hours for the confirmatory test to be done. So in all, it takes us 48 hours to get the confirmed yes, and that is dependent on when our sample gets there. So from our sample gets there, we would say about 48 hours.
Whether or not the person is male or female.
The person, no, I'm not able to say at this time, sorry.
And any other symptoms, the person should be diagnosed.
Just elevated temperature now, and as I said, we continue to monitor this person.
Yes.
In terms of the isolation facility.
You're asking what's the difference between the two?
And what's the spread of the
Okay, So essentially for a quarantine facility, what we really need is that the person is separated from other persons and there is minimum contact. Okay? So we restrict persons who are in quarantine from going outside of their homes, okay, for those that are in home quarantine. And essentially in a home, what you really need is just a room and an adjoining bath. That's what you need, okay, to be able to keep the person separate. Again, I just want to reiterate in terms of the general precautions, in terms of making sure that you keep your distance. 3 feet is what we recommend. The person who is at home who of course does not want to spread any possible thing that they may have to their relatives will take the necessary precautions. In terms of, some of them may wear a mask, okay, to prevent, if they're talking to their relatives or friends, they may choose to wear a mask. So the washing of hands is very, very important, because any kind of droplets that get on your hand, you can transfer to your face, and you can therefore get it into your ear passages or into the eyes and cause an infection. So the washing of hands, making sure that you have that facility, and also the hand sanitization if you don't wash immediately, that is also recommended.
In terms of the isolation, how are the patients isolated exactly, and what precautions are they?
So in isolation, what we have now is definitely a more restricted conditions. So we would have a room that is essentially sealed off from the rest of the hospital facility, or then you are going to, okay, so the persons that are entering into that room to interact with the patient have to make sure that they're fully protected. So they usually don those personal protective equipment on going in, and then on coming out, they remove all of those things and discard. They isolate persons together. For example, if they're close family members and both suspected to be infected and have the same kind of course together. So, we may choose to isolate persons like that together. But for the most part, we will separate persons.
Let me just say, if I may clarify that in the first instance, in the first case, the initial person came to Anatope, I think it was. That person had checked themselves in, and then the medical staff took the follow-up, which led our entire quarantine days. We felt sufficiently concerned to move to a higher level of which would be isolation. All right. Any other quickly? Yes.
When you speak from area fit, have you identified an area for quarantine?
Yes, I understand that one facility has been identified. There's some work being done now on that facility, and more will be said on that soon enough. On the issue of quarantine facilities and the St. Joseph Hospital, I just want to make it clear that I do intend to have conversations with the, do not want the impression to be given that we are not sensitive to those concerns. And I want to say that we are in dialogue and have been to find suitable locations at different places throughout the country. It's not very easy, but we are looking. And if the need arises or the occasion presents itself, then maybe some additional adjustments can be made. But as of now, I also want to reassure, based on the clinical advice, and the same was spoke with earlier, that the configuration of the hospital, the area identified, located for quarantine, is sufficient not to pose a risk to any of the citizens. And I just want to reassure them that we would not do anything to compromise the health and wellness of any Jamaican citizen in the carrying out of our responsibilities. And I think that needs to be made very clear. Any other quickly?
What of the training of the specific doctors and nurses who do not attend to individuals in isolation or quarantine?
What you want to?
In terms of infection prevention and control. And every year the ministry rolls out a training to the novel coronavirus flu season, and the same precautions apply. Okay. And so the same risks apply. So we have conducted quite a bit of training since January for health providers and for all practitioners, and also for persons at the or points of entry. However, this does not stop here. We will continue to train persons, and in particular, persons that are going to be manning the treatment sites, the quarantine sites. We are rolling out more training for those persons. But I also want to mention that within hospital themselves, they also have their own in-service training that continues.
All right, I'll take two more questions and then we can follow up after. I know it's your prime time news time, so yes.
Person is being isolated at St. Joseph.
No.
Have no persons Joseph's Hospital, okay? And St. Joseph's Hospital, okay, and that is for persons that are
Yes,
okay?
but that person, where is that person?
Presently, that person remains at the facility that we have quarantined, and they are being isolated, make all the decisions. So we are making runs because two facilities right now, we only have one active facility. Okay, we had been we are exploring option is there, then our national isolation area that we have designated is a National Chest Hospital. Okay, we have 2 beds at that area, and then we also have other facilities like the University Hospital where we have additional beds. We are now exploring the other facilities. As you can imagine, most of our facilities for managing patients are open wards. And so we have to look very carefully at these facilities to ensure that whichever area that we select, that it meets the requirements. So right now, as of now, as we speak, we would have a national chest that is ready, as well as a university hospital. And we are exploring the others to see how quickly we can get those in place, just in case we may need them.
Thank you. I'm going to ask Dr. Gandhi from PAHO, the country rep for PAHO, just to say a few words, and then I'll just wrap up, and then you can follow up with your questions.
I would just like to commend the Ministry of Health and Wellness for the work they have done and the response so far in terms of preparing for the coronavirus. I think that this speaks to the effectiveness of quarantine, because remember, the quarantine of a perfectly healthy no, it's just that they have a small risk, and they have effectiveness of picking up any change in their condition and isolating them. That is what is needed to contain the virus globally. So I would just like to commend the Ministry of Health and Wellness for the early and effective action they have taken, and we in PAHO continue to support the Ministry of Health and Wellness in terms of training, in terms of the laboratory diagnosis and increasing that capacity, and work with all our partners to ensure that we support the Ministry of Health and Wellness in their response. Thank you.
Thank you very much. So my closing comments will be brief. First of all, thank you very much for being here and for helping us to keep the public informed. I want to just emphasize again that this is our attempt to keep the public engaged and informed, not to spread panic or to fuel rumors. And I think that's very, very important, because we have to, I think, ensure that we take an abundance of caution in our approach so as not to run the risk or enhance the risk of our population being affected by this novel virus, while at the same time continuing our responsibilities to the country and to the people of Jamaica so that we can all carry on in our normal routine. So this recent development, which involves this particular individual who was in quarantine, now isolated, and to be further isolated if necessary, is an act based on ensuring that we take maximum precaution to protect the population. And that's really what it is. But at the same time, we want to keep the public informed, hence calling you to the table today. So thank you very much. We appreciate the time, the effort, and the coverage. And we say to the Jamaican people, we will continue to keep you updated on this issue and our management of it. Thank you. All right. Thank you very much. Thank you. Bye.
Coming on to the end of our live coverage here of the press conference that was live there by Minister Dr. Christopher Tufton. Giving an update of Jamaica's readiness, an update on the state of the virus as a threat to Jamaica and other persons. Live update on TV, and thanks for watching. Keep you update with these happenings in Jamaica. So bye bye for now until another update. And also there's later on for Hagley Park project, and also the White Wing project is also on, and also give you more on the channel. Again, thanks for watching. Feel free to like, share, and subscribe as usual. Thanks in advance.